Everybody, welcome back to the You're Not Broken podcast. I have the immense pleasure of having Dr. Sunny Smith on my podcast today because I've known Sunny since before the podcast. Yes? BP.
Yes.
BP,
Yes.
before podcast.
BP.
BP. Like long story, very short. Sunny was probably my first time I was ever coached. And I was on the weekend. I was headed to my office to go to the hospital to do rounds, but I knew this coaching hour with Sunny was like happening. And so I thought I would just log on and like see what happens and basically look at me now. So let's start with that. Let's start with that story and like
Basically.
how you remember it, Sunny, and welcome to the podcast.
Yes. And look at me now. Well, I remember it very similarly to how you do. And you came on and, like the leader and winner that you are, you raised your hand right away. So you were the first person that I got to coach on that
I don't have time to wait
call.
around. I got to go round.
I know.
Like, let's get this done.
I know. So you came on and you told me, okay, so I'm a urologist and I have this idea. I want to talk about sexual medicine. I want to have a podcast. I'm kind of like dabbling in this. And I was like, hold up. Our language, because coaches tell you your thoughts matter, your narrative and your perspective. It really, really matters. And I said, are you dabbling or are you really committed to making a difference in this? And you said, I'm committed. I'm doing this. And I said, okay, because it's a decision to be made, whether you're dabbling or not. And then we spent the rest of the coaching session talking about whether you were dabbling and what a dabbler would be doing and what someone who is really committed to this would be doing. And that contrast for you was so stark that you were just like, I'm decided. I am not a dabbler. I am doing this. And if I'm going to not dabble, I said, okay, so what would someone who's not dabbling do? You're like, I would go make an LLC, but now I have to come up with a name for it. And then you're like, well, should it be this or that or this? And I was like, it doesn't matter. What matters is that you decide. And you're like, I've decided this is a real thing. Now I have to go tell my husband, like, I'm making a company. I was like, yes, you are. You're making a company. And so now every time that you achieve something amazing and impactful in the world, you kind of tag me or reply to me, not dabbling, or just over here dabbling, like over here dabbling with Oprah, over here dabbling with the FDA, over here dabbling. And it's like, that is the difference between committing to something and really being dedicated to going all in and taking it seriously. And I think a lot of women in particular are taught to sort of downplay and be humble and sort of, oh, I'm just dabbling in this. And it's like,
If
no,
you're dabbling,
I'm taking over the world.
If you're dabbling, the critics won't hurt you as much because you're not out there announcing, right? Like there's actually, I think, a lot of protection in being a dabbler. Protection, safety, right? Of like, you have to become the person who isn't dabbling.
Right, because you're just minimizing. You're minimizing your accomplishments. You're minimizing your possibilities. And if you introduce yourself, hey, I'm Kelly Casperson, and I kind of dabble in podcasting and sex medicine, then they're like, okay, as opposed to you're like, hey, I'm Kelly Casperson, and here's like the level of achievements that I have done in this world. It's just the way you present yourself to everybody and to yourself and even to your family. The first person you said you had to tell was your husband that you were no longer dabbling. And then you go forth as if you're owning your space. And I think that's really beautiful for all women, including you. Everybody listening, look at what happens when one woman physician decides to own her space and own her expertise. We all have expertise that we downplay and we're told not to brag, right? And not to be too big for our britches. But here you go. Every one of us has expertise in our lives and in the world, and speak your voice and take up space. Just as you did. It's an epic, epic story.
And like, it's such a good story. And like, there's so much ownership that comes. Somebody asked, I was somewhere on the internet and somebody was like, how did Kelly Casperson get so elevated? Agent, stylist, like what? And this was a female wanting to have some sort of outside circumstance as the reason for my success. And I was like, fuck off. I was like, there was no agent or anybody that I'm like, this is hard work. Like, this is hard work. And that's the other thing too, if you look at somebody's success, don't ever downplay it for 1 second that it was an incredible hard work where like nobody was watching for a very long time.
Yes.
Right. And so, I own it. I'm like, I won't.
Exactly.
Nobody else gave me my success. Like, this was all me.
Yes, it's not agent, it's agency. It's
Yes.
your own
Yes.
internal agency. You chose that agency that you were going to go out and make a difference, as you said, when no one was listening and no one was watching. And you said, this is important. People need to hear this. I need to speak. And why not me? Right? Why not
Yeah,
you?
totally.
Own the space. Yes.
And the other thing for me was I was waiting for permission. I was waiting for
Yes.
and this was a man, he knows who he is, because we joke about it now, because I was like, this guy that my brain had picked was gonna call me on the phone and tell me I knew enough, and why don't I start a podcast? Like, that was my brain's plan for, like, when
Mm-hmm.
I knew enough to do this, right? And I got out of the shower one day, and, like, lightning struck and was like, "The only permission you need is your own." And I
Absolutely.
was like, "That's it!"
Yes, yes. If women could, everybody listening, think, give yourself a permission slip. What is that thing that you needed, like a letter from the principal when you were little, a permission slip to go do something? Write it for yourself. What is it? Saturdays off, a babysitter, right? Time to yourself. Like those are little things, but it's also speak your voice. What are to not let your mother-in-law bother you, to go for the promotion, to what are the things that we need to buy the fancy thing? What is it that we're waiting for someone else to give us permission? And the truth is, we're the only ones who can ever give ourselves permission, because even if someone else does give you permission, you can still hold yourself back. Right? Like if that dude had said, hey, why don't you go make a podcast? You're like, well, I don't know. It
No, I
really
know.
comes from giving ourselves, what do we want to give ourselves permission for? The big things, the little things, to let ourselves off the hook, to say no to things, to say yes to big things, and just begin again. And the compound effect of doing that over time is basically the results that you're seeing.
Yeah.
The compound effect of doing that over time is
Yeah.
unimaginable.
Yeah, so for anybody's like, "They're just lucky." Nope.
I know.
That is the story society wants you to believe for, like, hard work of, like, "No, they
Well,
work very hard."
isn't isn't it like luck favors the prepared or something
Yeah,
like
yeah,
that?
right.
Like,
Yeah.
is
What is it
there
like? Yeah,
some
luck finds people who are working, right? Or so there's something
no,
like that. It's
exactly.
like, yeah, good fortune finds the person who's already
Yes.
putting in the time.
Yes.
Let's talk about you have 2, I mean, you probably have 7, God bless us all, 2 pretty powerful health stories, and I wanna share them with people because for multiple reasons. But I think there's something that's happening in 2026, started in 2025. Women and people are realizing the gender disparities in healthcare. And it's something that I think female physicians have been talking about for a while, but the
Mhm.
general population, and I see it a lot on my Instagram now. How come we have 6 different types of Viagra? How come we have over a dozen different types of testosterone? How come we had an incorrect box warning on vaginal estrogen for 25 years? Right? Like the
Mhm.
gender disparities in healthcare,
Yes.
and I think that the normalization of that and people really wanting to feel validated by hearing these stories.
Mhm.
So I wanted to, if you would like to start with your story about you in residency training and what happened, the documentary, and fill me in because I don't know this whole story.
Yes, so I was an intern in family medicine at Santa Monica UCLA before there was work hour restrictions. So that meant that they could work you as much as they wanted. And so we would take 36 hours, I'm sure. I don't know when you trained, but if you did train when I did, then everybody took 36 hours of call
Mine
and you did it like
work hour
every 3 or
restrictions
4.
came in halfway through residency for me,
Yes,
whenever
yes,
that was.
beautiful. So
Yeah.
exactly. So came in a healthy 20-something-year-old, no problems at all in the world, start taking call, and started on those hard call months that I had, like obstetrics, or we did pediatrics at a very busy place where there wasn't anyone to like push people to the MRIs or draw the neonatal blood in the middle of the night or any of these things, like all these things that now there's support people for. We were those people. And so during those times, I would get these focal neurologic symptoms, which were bizarre and very real. So I would take call, be up, start feeling a little bit off. And then suddenly, like one time I was in obstetrics at Cedar Sinai, taking out someone's staples from their C-section. And all of a sudden I was like, and the patient was trying to talk to me. And I was like, I couldn't talk. I had aphasia, which for those who don't know the word aphasia, it means you can't speak. But I knew what I wanted to say and I knew what was going on, but I couldn't speak at all. Like it just made no sense to me. And so the patient got out of the bed. She gave her husband the little baby. She put me in the bed. She went and got the nurse. They wheeled me down to the emergency department. And over time, it improved and got better. And my studies were normal. And they're like, well, we'll have you go see a neurologist. And various things kind of like this kept happening, strange things. And the neurologist was like, well, it's very stressful being an intern and, it could just be migraines. We don't know what it is. And, don't worry. And I was like, I'm $100,000 in debt. I worked my whole life to become a physician, and I'm having things where suddenly parts of my body don't work at all. I'm worried. And then I happened to be, since I was in Los Angeles, I was being filmed for this documentary. I didn't sign up for it. It was right before reality TV, but it was like a real documentary. And it later showed on Discovery Health and the Learning Channel, TLC. And so they cut from that scene where he's like, don't worry. And I'm like, I worry. To me going in an ambulance because to the hospital because I drove down to the sort of Hollywood, where the stars are on the ground. It's the Man Chinese theater. You put your hands and feet in the ground. So I had just driven with my grandparents there, and thank goodness I had just pulled over the car and gotten out and walked there. And I told my grandparents, I said, oh, I don't feel well. And so I squatted down to the ground. I'm like, I don't feel well. This kind of thing happens sometimes. I don't know what it is. My arms started shaking. I'm like, this happens. Don't worry. And then, of course, I fell over. And it turned out that I had status epilepticus, which is a very prolonged seizure. And so all those things I had been having were focal seizures. But no one thought I had a focal seizure. They just thought I was kind of a stressed out, anxious young woman, maybe with some headaches. And so I didn't stop seizing for a long time. They put me on a lot of medications, intubated me. And so I went into the ICU and I didn't wake up for a week, and they didn't know why I wasn't waking up and if I'd ever wake up and if I'd ever be the same or if I'd be okay or if I'd be sunny. And certainly no one thought that I could be a doctor. And so finally, once I did wake up, they gave me like a month of some kind of like behavioral science / vacation / something so that I could recover. I was pretty out of it and needed to go to PT and relearn a whole bunch of stuff, and was overdosed on Dilantin, so was like really out of it for a while. And then when I went back to work, all I ever wanted was to just go back to 36 hours of call. Every 3 to 4 days, like everyone else, right? Because everyone was actually kind of mad at me for being intubated in the ICU because they had to work harder and they had to cover my shifts. And so it's just that speaks to the state of burnout and the culture of medicine, of how hard we are working people, that obviously they had some sympathy for me or cared for me, but they're like, but I have to take her call? This is bullshit. I'm like, how much more sick can you be than intubated, unconscious, comatose in the ICU? And people are talking about how unfair it is to them, right? Okay. And actually 3 people at my internship in my residency seized that year because we were all working so much. Mine was just the worst. But I mean, we had healthy, another person in my class and another person in a senior class who was like an Olympian. I mean, these are healthy people who, and I found out during my follow-up that across the country, interns seize. This is something that happens. And because sleep deprivation causes seizures. And so I stayed on the medication and I just wanted to go back to call. And now in hindsight, now after having this second episode, that I'll talk about in a second, and knowing how fragile and precious life is, this version of me that's now 50 years old, when I look back, I would be like, to take radical responsibility for what happened to me, right? Like to just be like, okay, what could I have done differently? I'm definitely not blaming myself or gaslighting myself, but looking back, I'd be like, hell no, I just had a seizure and almost died. I'm not going back to 36 hours of call. Are you joking? What are you trying to kill me? No, I get to have like ADA accommodation. Like it was very clear that I had something very real, and I just went back to work. I mean, I had to not take call past 10 p.m. for a little while, but I stayed on seizure medicines the whole residency just to be able to stay up in inhumane ways. And so there's actually clips of this. This was pre-YouTube right before then, but there's clips of it in a documentary right now called Do No Harm, the Hippocratic Hoax, where people can see me literally intubated and unconscious. And it's like, how is this okay? And we're like, all okay. just go back to work. Good luck to you. And so there's a whole conversation to be had about the medical culture that normalizes all of that. But then there's also, when we talked about agency and autonomy, like I was so young and naive, I didn't know to say, my life is way too precious,
Yeah.
right? To be my own best advocate and be like, this is not happening. This has happened to others. We need to stop this right now. And even if you don't stop it, I'm not going to be complicit in this. But it only came to that realization. Like I've thought the medical culture caused this whole time, and that's a tragedy. But only this past year was I like, wow, life is the most precious thing there is. It doesn't matter that medical degree, that practice, that $100,000 loans. I could have been dead. So that's what matters most is if any of us are here and alive, you have breath, you have everything you need, right? And
Yes.
then you just get your agency and try to figure out how you can advocate for yourself in whatever way that is. And if where you're advocating isn't working, go somewhere else and advocate where someone's going to listen.
Yes. Totally. And as much as you can, I mean, what would you have done if a senior physician was like, "Hey, maybe don't do this," or a parent was like, "Hey, maybe don't do this." Like, what if there was that like grounding outside voice? Do you think you were too indoctrinated to be like, "I got to keep doing this"? I don't see because what I and where I'm going with this is so many physicians, and this could be any job, right? But so they don't see that there are any
Hmm?
other options.
Right. I did not see any other options. I was, negativity or any kind of bias, whatever, narrows your vision and narrows your focus. You can only see what you can see. And their brain also has confirmation bias, right? So reticular activating system activates and goes to look for what you tell it to look for. So like when you get engaged, you notice everyone's engagement ring. When you're pregnant, you notice everybody is pregnant around you. When you buy a red car, you notice the same car. So I was like, surrounded by people who everyone's like, you have to do it this way. You have to do it this way. I was like,
And
I
furthermore,
spent
we're
my whole
disappointed in
life.
you because I had to take more
I
call,
know. Exactly. So I'm
right? So
like,
there
I better get back to work and relieve everybody. And I worked my whole life for this. And plus, don't forget the whole determined, physician is like, don't tell me what I can't do. Right.
right.
I'm gonna do it.
Yeah.
I'm not disabled. I'm not a problem. I'm strong. I can do this. I've achieved everything I set my mind to. But that's the wrong frame, right? The frame is this is bad for your health. You had a completely life-threatening illness that could have changed your brain forever. I mean, my brain was never really quite the same after that. And why go back to something? I couldn't even imagine anything else I could have done. Like, what would I do? Yeah, this happens to lots of doctors, lots of professionals, but in particular doctors who are thinking of stepping back. They're like, what else could I do? Like, I know to the general public, people think that, oh, we're smart and we have options. And they don't think that. Physicians do not think they have any option because we're trained to do one thing. And how does that transfer? People don't feel like it transferred. I was like, what am I going to do with my $100,000 in debt and no job?
And you're like, "I'm actually very good at this one thing that's killing me fast or slow."
Exactly.
Yeah. Yeah.
Yeah.
Wild. So then fast forward, you lived an exceptional life. I'm skipping many, many years. Oh my God. And then the new run-in with the American health system was, remind me, I'm trying to remember, was it after COVID? You went
Yeah,
into
it
the
was just a
emergency
year
room. It
ago.
was a year
Yeah,
ago
it was
now.
a year
Okay.
ago.
And you were in California
Yes,
when
San
this happened
Diego.
again. San Diego again. Okay. So fast forward us to this event.
Okay. So this is a story about, I mean, if the last one had a little bit of medical gaslighting, not listening to someone, this one is like that on steroids.
Yeah,
Because at this
if
point,
anybody was wondering, have things gotten better since we were in training? Let's tell you this story.
yeah. So I think a lot of women will see themselves in this, perhaps not to this extreme, but that people aren't listening. So I was going with my son, who was 11 at the time, and our dog to the grocery store 2 days before Thanksgiving to buy a bunch of stuff. And I drove there and I was fine. And as I was walking down the aisles, I started feeling really lightheaded and really weak. So I made it back out front. I sat on the curb and I was like, oh my God, there's something wrong with me. I say to my son, like, go get me a soda or something. Maybe my sugar is low, like something. I just felt really, really off all of a sudden. And I was like, I can't get up. I can't drive. I can't stand. I literally couldn't stand. And so I was like, okay, I'm going to try and crawl to the stop sign so I can like maybe get up and we can get an Uber home. I couldn't even crawl, nothing. I just suddenly was incredibly weak. And so I had my son call 911. The ambulance comes, they pick me up off the ground, put me in the, whatever they put you in the wheelchair with, on the gurney, not the wheelchair, the ambulance, on the gurney. My vitals are like tachycardia, and I'm feeling terrible, and I'm kind of panicked, and, like, what's going on? I'm shaking all over the place, and they call into the hospital. When I finally get to the hospital, they're really busy. And so they leave me there with the ambulance for half an hour. Since they didn't have a room for me, they then decide they're going to put me in the lobby. And I don't know this is exactly going on because I'm so out of it. And so they put me in this chair and they're like, sit up straight. And I literally can't sit at all. They put me in the chair and my head is touching the ground. And they're like, sit up. I'm like, I can't, literally can't. So they push my head back up. It falls so that I'm trying to sit. It falls back forward to the ground. Meanwhile, my little boy's still there holding our little fuzzy Shih Tzu dog, witnessing the whole thing. And I'm like, when I see that they're trying to take me not into a room, I say, this is gender bias. I'm a woman. You think I have anxiety. I have a critical illness. I'm a physician. I need to see a physician immediately. And I didn't know what I had, but I knew there's sick and not sick when you're a physician, right? When lay people say they're sick, they mean like I have a cold. When a physician says this patient is sick, it's the same exact word, but what we mean is this patient could die.
Yeah.
That's literally what we mean.
Yeah.
This patient could die soon. This is a sick patient. So I was trying to use that language and communicate, but they thought I was using the layperson language, right? And so they changed my chief complaint because they can't put me with the vitals I have and the diagnosis that I have in the lobby. They want me in the lobby. So they changed my chief complaint to anxiety. And they put me in the lobby. And I don't really know I'm in the lobby.
For people who don't know, that puts you at the back of the line because that's not that life-threatening.
That's not life-threatening at all, even though I came in by ambulance and had abnormal vitals. They thought my abnormal vitals, they were telling me, stop breathing so fast. Your heart's going fast because you're breathing so fast. I'm like, or I'm dying, because dying people get breathing fast and heart rate right fast. So I'm out in the lobby and I sort of come to enough to realize I lift up my head and I'm like, oh my God, I'm in the lobby, like all by myself. It's just me and my kid and my dog in the lobby. So I start screaming that I need help. And so they call security on me. And so, well, actually what happened right before that is that I have to go to the bathroom because it ends up that I have urosepsis is like the end to the story, which, by the way, I had not been put on vaginal estrogen to prevent urosepsis. It's a preventable diagnosis with vaginal estrogen that you always talk about, but I wasn't taking it. So I had to go to the bathroom and they wouldn't help me go to the bathroom. So I fell completely onto the floor, laying flat on the floor in the hospital. And they said, get up, get up, get up. You're causing a scene. I was like, I'm sick. And so then they said, we're going to call security. I was like, good, please call security, call someone, call the police, call anyone. I need someone. Please call me someone. So the security people come over and they put me up in the chair and I was like, please call a doctor, please, please, please. And he says, I can't, ma'am. He was like so nice, looking me right in the eye with the other security all around me. He's like, I don't have the authority to call a doctor. So then I realized at this point that my whole body is shaking so hard. I was like, oh my God, I have Rigers. Rigers means a type of shaking that people get.
Shivers.
Uncontrollable shaking that you get when you have a blood infection called sepsis. So I was like, it just came to me after I'd been there for like an hour on the ground being yelled at and being called disgusting and despicable and all this stuff for being stop causing a scene. And I'm like begging for care. And I'm like, I'm not okay. And then I tell my boy, I'm like, mommy's going to be okay. I'm going to die. Mommy's going to be okay. What do I do? Because no one's tending to my son this whole time. And so finally, like an hour or two in, I start telling people, I think I have sepsis. Call a code sepsis. It's 50% fatal. And I'm like, I'm a doctor. You can Google me.
Right.
50% fatal. Really, like there's stroke code, there's heart attack for chest pain, and then there's code sepsis. Like there's not that many codes. You just don't call that many. So I'm like yelling these things out to them so that the people behind the thing can hear me, the nurse close to me can hear me, the security can hear me. I'm like, get me a doctor. Call a code sepsis. Rogers, I can't sit up. I'm critically ill. And they just kept telling me I had anxiety and to stop it. And they were going to, if I didn't. So then eventually, finally, once I get taken, they called security on me several times. eventually, once I get into the triage room after hours, then they put on my EKG and they're like, stop moving. Your EKG looks terrible. It's moving all over the place. I was like, that's because I'm sick. That's why my EKG looks terrible. And they're like, well, we want you to do some breathing exercises. And I was like, oh my God, call a doctor. Breathing exercises. And they're all the while documenting in my chart how terribly sick I am and saying the things that I'm saying. And they're saying, like, patient is lying on the bedroom floor saying bathroom floor saying she's unable to get out. Patient is sitting with her head touching the floor in the wheelchair. Patient is saying, I need a doctor. Patient, but like they thought they were helping their case because they thought that I was just being obnoxious. So they thought that they were trying to document my obnoxiousness. And then so finally I'm like, even if I am a psych case, because I'm just saying everything I possibly can, any data I know, any advocacy I can do, like, even if I'm a psych case, I deserve medical care. You can give me like anything that you need to give me. You can give me Ativan. You can give me whatever. Just get me to see a doctor. Everyone deserves care. I need care. And I was like, I'm going to code. Right. And so then anyway, I started then at that point when they had the EKG on me and I was all curled up in a ball. My hands were curled. My elbows were curled up. My knees were curled up. My jaw was clenched. I was like, jaw clenching. Do I have hypocalcemia? What about, like, I'm going through all this differential out loud with them and they're like, you have anxiety. I'm like, ah. So finally, I get this feeling suddenly of impending doom, which doctors hear about, but it's this idea that the patients get that, oh my God, I'm going to die right now.
Shit's going down now.
I'm like inside your body, you're like, oh my God, I'm going to die. Like, this is it. I'm really going to die. And I'm surrounded by security with my little boy holding our dog. And the nurses aren't even close to me. And like, nobody is helping me medically. And I'm just like, I am going to die. I am going to code. And so finally they're like, well, because they're like, if we can't make your EKG normal, we're going to put you back out in the waiting room. So, which I was like, you're threatening me. You're literally threatening me to put me back in the waiting room because I have an abnormal EKG. This is not normal. And they're like, well, you need to stop shaking because we can't. So then when they brought the doctor in to see the EKG, he just told everyone immediately, clear out. And he's like, his first words, I am so sorry. I am so sorry. I am so sorry. I am so sorry because I had such tachycardia and ST segment changes and I was clearly critically ill. And so he took care of me right away. So that is the story of I'm an English speaking, white, educated, full professor who worked in an emergency department, who knows how to communicate very clearly about my exact diagnosis and communicate very clearly repeatedly that it's 50% fatal. And they kept telling me I had anxiety and kept calling security. And so anyway, anyone who's a doctor who's listening, my lactic acid came back at 5.6, which is very ill, like critically intensive care ill.
Incompatible with functioning physiology.
Yeah. So no wonder I couldn't sit. No wonder I couldn't stand. No wonder I couldn't even get up from laying on the ground at all. And no wonder I was a little bit altered in my mental status, trying so hard to communicate, but not able to. And my whole body all clenched up. 5.6 is really terrible. And so the minute that the labs came back, then they started treating me. And I was like, and this is a standard of care, just for the listeners who don't know, every doctor would know, but this is a standard of care that every hospital in the whole country must meet. It's door to IV antibiotics, less than an hour, because people die from this. And if you don't meet that standard of care and have screening criteria for it, you're in trouble with the hospital systems and the nursing systems and the overseeing, governing bodies. And this was a huge miss, where I truly think if I had been, because I'm in San Diego, California, so if I had been a minority non-English speaking person, I think I would, and not a doctor, I think I would be dead.
Yeah. I mean, you advocated the best you could, and nobody could have done it better than you.
Right. And I was telling them, this is gender bias. I am a woman. Imagine my vitals if I was a man. Right? If you have a pulse of 150 and you roll into the emergency department as a man, what are the chances they're going to call you anxiety? They're not.
Zero.
They're going to get an EKG on you
even if the guy said,
the
I'm
ambulance bay, right?
Yeah.
Even if he said he's anxious, if his pulse is that fast, they're going to get an EKG on him, right? I'm 50 years old. A 50-year-old man comes into the emergency department with tachycardia. What are they going to do right away?
Heart attack until proven otherwise.
Exactly. Exactly. All it was my gender. And I just kept saying, and they even documented in my medical chart, patient is saying this is gender bias and we're calling this anxiety because she's a woman. It literally says that.
Holy shit.
I know. I know. Yeah. So I'm working to get my goal this year has been to get the footage of the hospital from the hospital, because at first they were saying that they wanted me to speak to their department. The head of the hospital called me and asked me if I wanted to speak at Grand Rounds the next time on anchor bias. I was like, I think this is gender bias. He's like, I think it's also anchor bias, because once one person calls you anxiety, everybody signs you out as anxiety.
Oh,
right?
interesting. I had not heard that term before.
Yeah, anchor
Okay.
bias.
So
Because once it
you're
got on the chart,
validating
it's over.
you're validating the
Mhm.
people on your team, basically.
Okay. Yeah. So just like any of your listeners who have some kind of issue, if they're getting labeled in the chart a certain way, then the next provider and the next provider that sees them is more likely to continue this chart lore or this bias that you have, what someone before you said that you had. And so he wanted me to come talk about that. But then as I was continuing to ask for the video, because again, it looked like a scene from Cops. Anyone who's old enough to remember Cops is like all the all the security people, all the police around, and there's like scuffles and all this stuff. I was like, I would have been better off like on the street, seriously, than in this hospital, because every time I asked for help, I was criminalized, basically. And they called like a code green because I was like a threat to others. I'm like, I can't get off the floor.
Yeah.
I can't even move. How am I going to others? So, yeah, that I just think that for people to realize it's not just these outpatient things. It's not just hormonal things. It's the whole entire system we have been taught. Like hysteria is a woman with a meandering uterus that's making her crazy. So that's what I was assumed to have, was hysteria
Yeah.
at that time. Right. And so just, you're not crazy if people don't listen. Right. And also if you want to give them any kind of like, I don't know, understanding, people sometimes don't know what you have. Like for all the women who listen to your podcast and go in with all these symptoms, and I had been going in with random symptoms before I got on hormones, and I had asked for hormones, and people had told me, you're still having a period, you don't need hormones yet. I'm like, have you listened to Kelly Casperson? Please.
My friend the Dabbler, she's doing some work now.
My friend the Dabbler, literally the first time I was prescribed hormone therapy, I told the person, when she told me that, she's like, you do not need hormones. You are still having period. I was like, please look up my friend Kelly Casperson. Please look her up. And then I'm going to go somewhere else and get my medical care right now. Totally. And then anyway, we finally did that. So it's, yes, people often, they just don't know. Sometimes they really, truly are not. Like those people didn't think they were gaslighting me. They thought they were right. They thought I was a crazy, obnoxious woman. And the people who are, writing off your audience, the doctors really don't know. And so it's going to take a long time. I used to teach on hypertension at the medical school, and it's called benign essential hypertension because it was thought to be benign and essential. Right. And it took a long time.
What the body does.
That's what it does with aging, is what we used to say. And so I would teach things about like, former presidents who the trajectory of history and the world wars would be different if we had treated their hypertension, but we didn't. So they would die of a stroke with a blood pressure of like 300 because we didn't know to treat it. And it takes years. It's like, how do you take these years and decades of transitioning from where everyone used to think hypertension was benign and essential to getting people treated? And this was something that would kill people, right? And so to look at how can we do this now with something that is with symptoms that seem much more vague to many.
Yes. Yeah. Well, and I think the belief, and I just saw this in a physician Facebook group. They're like, is menopause the new hysteria?
Yes.
And they didn't mean it as if hysteria was real, my friends. And so my response to this was, and there were several OB-GYNs who said, I'm an OB-GYN. Yeah, this is people just need to deal with aging better.
Right.
From the words from the physicians. And so I rarely write in groups anymore. I'm like, I see what the zeitgeist says and I move on. But I was like, hysteria was real. Menopause is real. It's time to start believing women.
Yes.
And then multiple physicians were like, thank you very much. I agree, blah, blah, blah. But it's the culture of replacing ovarian function. Like even the belief Are ovaries worth replacing?
Right.
We are not there yet. That is not a universal yes. That is a
Not even
5%, that is
close.
a 5% of the population yes.
No, I just saw something recently too. You and I are in similar groups. Many of us women physicians are, where they said, what do we do with the needy perimenopausal person and these needy patients? And they
Same
had
thing.
they were really trying. They were like, I have these things and these things and these things I do. And I was just like, so needy, but calling us needy, it's like, that's pejorative. I see that I commend you for trying to want to treat these people better. That was the request. How do I treat these needy people better? I'm like, and please look at your bias by labeling. Would you label someone with a broken leg as needy
Right.
or
Yeah,
not? Or would you be
totally.
like, this person has a broken leg. Let's give them a cast. This
Yeah.
is what we do. Bones can heal. Right.
And I think, and thank you for tying this so nicely into coaching because we aren't aware of the power of our thoughts. And I think
Yes.
this is, I maybe I'm not aware of why we shouldn't call these people needy. We like the power of what we say is so profound and we're so oblivious to it.
Yes. Yes. We think we're just reporting the news.
These are facts. These are facts.
These are all facts. It's a fact my doctor won't listen to me. Like, I get in your audience, that probably feels very true, right? I would say that thought probably doesn't serve you, right? Because how does that thought make you feel? It makes you feel frustrated. And then so what is your action? You give up.
Victimy.
Yes. We are no victims. Even those people on the other side who wouldn't listen to me, I was like, listen to me, right? But if I'm like, they're not listening to me, that's disempowering. If I can be like, agency, you are going to listen to me. Here's some facts I know. Here's some facts I know. Here's some facts I know. Somebody start listening. Hey, will you help me? Will you help me? Will you help me? So if you're thinking your doctor's not listening to you, or all the doctors aren't listening to you, right? These sort of like broad sweeping statements can be very disempowering. And so it could also be a fact. You can narrow it to the specific scenario, which is like, this doctor isn't prescribing hormones for me today. Okay, that is true. If you look at this doctor isn't prescribing hormones for me today, that's a very different thing to doctors won't listen to me.
Mm-hmm.
And so, okay, this doctor today, maybe we just bail on today, or maybe we bail on this doctor. Maybe because you could still say, like, there's lots of experts out there and I'm going to find one.
I need to find one. Yeah. And
I
it's
need
up
to
and it's
find
up to
one.
me to find one.
Exactly.
Nobody's going to be like, here's the one for you.
Right. And it's both and. It's not like we're saying like you're the bad person for not finding someone, right? We're saying the medical culture is what it is, and misogyny is what it is, and the patriarchy is what it is, and medical history is what it is. We acknowledge all those things. And we say what you think about this matters, and how you feel about this matters, and what you do about this matters. So we all have agency, even when you have like so little ability to do anything. I remember for some reason, this just came to my mind when my brother was really sick and he was intubated in the ICU and they had to do a trach. He couldn't talk and he still would use his eyes. And we were like trying to figure out, we were like, should we get letters? Should we do? And I was like, this guy has so much agency. He cannot move out of this hospital bed at all, but he knows what he wants and he is communicating it to people. And so I feel if we can just always remind ourselves that no matter the situation, there's some place that we have control, and there's so many things that are outside of our control, and especially in the types of things that you talk about, there's so much that is out of your control, but there's always something that's in your control, and that's how you're gonna choose to see it. And again, you don't want it to seem gaslighting to say that to someone, so it's acknowledging that there's challenges out there, and what do you control?
I love it.
Whenever you're ready for that part.
Let's go to like somebody who's never heard of coaching, has never been coached, has never, this is, blank slate, right?
Okay, this is like you. This is like you when you first came to me.
Exactly. It's like
Exactly.
how do you work the magic of how do you like crack the door? Is it like you repeat the thought back and start like how do you like what's the intro coaching 101? Thoughts create your feelings, create your actions, create your results. Thoughts are optional, they're powerful, and you can pick them.
Right.
Like where is this intro book? Like where is
Great
this
question.
because I'm like, oh God, is this book 3? But I want
Yes.
basic. I want intro baby step, 3rd grade reading
Yes.
level, basic coaching stuff, and go.
Well, what I would say if you're looking for a book, one that is not bad is Carl Lowenthal's Unfuck Your Brain
Yep.
book. Is that the name of the book
Yep.
itself?
Yeah, that's a good book.
It's the name of the podcast. I'm
Yeah.
just making sure that's the name of the book too. Anyway, Carl Lowenthal.
I'm pretty sure it's
I have
Unfuck
a
Your Brain.
copy in the
Yeah.
closet, but
It's good. I've read it. Thank you for reminding me of that book.
for a book that talks about how your thoughts create your feelings, and it's from a gender specific way. So I think it could be really powerful introduction if people want to look at that. But I think it's, for me, there's your thoughts you can look at, and then there's your feelings. And I think both can be super helpful. So one thing I could say is, like, if you're telling me, your doctor won't listen to you, I'd be like, well, how do you feel? Frustrated. Okay. And I'll say, you feel frustrated because what? And then whatever they insert there is a thought. They think it's a fact, but it's a thought. Like, I could have said when I was on the hospital floor, I'm feeling frustrated. I was very, very, very frustrated. And you could say, why? I would say, because no one is listening to me. And that's what my thought was. No one is listening to me. And is it true? Yes, there's truth to it. But is the thought, no one is listening to me, going to help me? No, it's going to make me feel frustrated. So I can say, like, your feelings, I think one thing that's important about coaching, we tend to focus a lot on the thoughts. And so like, if you were talking to me, I would just mirror back a thought. Like what we did, the example we gave is dabbling. You're like, well, I'm dabbling. And so I just mirror and I say back your thought. And a lot of our thoughts are really limiting beliefs, right?
Yes.
So if someone said, no one will listen to me, I would say, no one, right? Or so there's that mirroring back your thought, because when you hear your thought back at you, you're like, oh, and say we say something that's derogatory about ourselves, like, I look terrible in these jeans.
Putting on
Terrible?
muscle is hard.
Yeah, putting on muscle is hard. So I could also say we could do the thought, because how does that make you feel?
Stuck, challenged.
Yes. Yes. So when you feel stuck, what
Frustrated.
do?
Nothing.
Nothing. So then the thought proves itself.
Yeah.
Because then it stays hard, right? And then so sometimes I'll do, I'm learning, right? Because you don't believe something else. You don't believe that putting on muscle is easy. But I'm learning, or maybe, or it's possible that maybe, just maybe, it's not as hard as I think it is, or something. And we ask them to come up with something that makes them feel a little bit stuck. I say, well, what would make you feel a little bit less stuck? I think the feelings, we have evolved over hundreds of thousands of years, millions of years, whatever, with feelings for a reason. Feelings guide us even before we had language. Our animals don't have the same kind of language we do, but they all have feelings, and those feelings guide them. And so if we're feeling frustrated or stuck or sad or angry, those feelings are there for a reason. They're trying to tell us something. They're trying to get our attention. So it's like, okay, I feel angry. You feel angry because what? So name the emotion. What do you feel? And then say, because. And whatever that thing is, that's the limiting belief.
I credit coaching for, like, validating feelings. My big joke is, like, surgeons have one feeling, it's tight. Right.
Surgeons have feelings?
Right. Yeah. Well, we have one. It's tight. But it's like, especially if you grew up in a household where feelings were not safe or welcome.
Oh, yes.
And then you go through medical training where any sort of body sensation is ignored. Right.
Mm-hmm.
And so it's like you come very honestly to the point of, like, feelings are bullshitty. And then you're like,
right.
Right. So you kind of have to learn, like, no. Like when you learn, like, the wheel of feelings, right? You're like, whoa, there's a lot of words to describe these things.
Exactly. And maybe this is like a little bit more advanced than the 101, because the 101 might start with just the thoughts, right? And some people can sometimes come into the thoughts a little bit more easily. And so I could pick any one thought and say, how does that make you feel? Right. And if we know that our thoughts sort of always are proving themselves, then be careful what you think and what you say is the default, because you're going to keep proving it true. Like those people who think the COVID vaccine is not real, they're going to keep finding evidence for the COVID vaccine not being real. And I think COVID vaccine's real. And so I'm going to keep finding the evidence. So if you find whatever you're believing, you're putting on these rose-colored glasses or these dark-colored glasses, whatever it is, and it's not like toxic positivity or some kind of whatever BS type of thing, it's real. It's neuroscience, confirmation bias, right? As we said, it's real. Yeah. So you can start with the thoughts and look at what kind of results are your thoughts creating in your life. And if you look at any of your results, you can be like, how did I create this? Or which part did I contribute to this? Just like me taking those 36-hour calls. I contributed to that in some way because I went back and I chose it. Like, how could I have chosen different results? How can I create different results? And I think the sort of, if that's like 101, 201 is really, and I think it's even more powerful, as you said, how do you feel? Name an emotion. And as you said, validating the emotion because not all thoughts are valid, right? There are thoughts that are lies, that are flat out
Yeah,
lies.
and society might have put it in your brain. It might not actually be your thought.
Yes,
You might actually disagree
it's
with it,
not your
but
thought.
it's just a thought.
Most
Yeah.
of the limiting beliefs that we have about ourselves and the world around us are inserted from someone else. Like we get so much from our upbringing, from our family of origin, from what they thought of us, from what culture thinks of us, from what the patriarchy thinks of us. And so they get inserted in your head and then it sounds like your own voice, but it's not. You got that from somewhere else. So thoughts can be questioned and should be questioned. Feelings are all valid, just like you said. Feelings are real. If you feel scared, you're scared. If you feel happy, you're happy. It's not like you're lying that you feel scared. No, your reasoning might be erroneous, but the feeling is real. So it's like, what is the feeling? Why is it there? And do you really believe what that thing is about that you're scared of or feel, especially when people feel stuck? When people, because you mentioned something where, lifting weights is hard, I feel stuck. Feeling stuck is just something you have to learn, right? There's something that you need to learn. None of us are ever really stuck. Are we in cement up to our eyeballs? No, like we're clearly not stuck. So it's always something that's very coachable every time somebody feels stuck.
Yeah. I
What
had
do
I
they
had
feel stuck
a
and
patient
why?
recently that again, a coaching 101, so this is like beginner. What do you mean these thoughts aren't right? But then the thought was,
Right,
I'm doing everything I can.
right, right. That is a paralyzing thought. I mean, you'd think it feels powerful because you're doing so much, but
Right.
no
No,
one
no,
has ever done everything.
this was a very like leading to the feeling of disempowerment, right? Like
Right.
I'm
So
doing
always
everything I can.
yes, yes, and so I think that revealing when I say, "How do you feel when you think that?" And they'll be like, "Well, I feel like this person is a jerk." I'm like, "That's not a feeling. What's the emotion that you feel?" "Well, they are a jerk." I'm like, "Okay, but what's the emotion that you feel?" Right? I'm doing everything I can. And so if I ask enough, and then sometimes I have to put out feelings like frustrated or sad or whatever, and then they'll be like, "Oh, okay." And they say what it is, and I go, "Okay, so that makes you feel sad. Is there any other way that you wanna look at it?" Right? So just if we just look at what the feeling is, because it's not whatever if you haven't lost weight, if you haven't gotten the prescription you need, if your hot flashes haven't stopped, if you what a lot of people, believe they have a contraindication to HRT. For instance, the people who listen to your podcast probably will be less so than others. And so they feel stuck and they feel frustrated and we say, why? Right? So how do you feel when you think I can't take these? I feel whatever. And we go, okay, well, do you want to explore something different? Because if we just look at the feelings that come from our language, we think it's the circumstance. So the circumstance in that situation would be like, say you've had a pulmonary embolus, a blood clot in your lungs. That's the fact. I can't take hormones because I had a pulmonary embolus is a thought that is evolving over science because we think that science is, I mean, obviously we made a mistake for the past 20 some years, but we think that it's accurate. And the thing is, it's the best that we know right now. And when I would give talks at the medical school, we'd say, the thing is, half of what we taught you in medical school is correct. We've been saying this for, I don't know,
I
nearly
was
100
told this in
years.
med school and
Yes,
it stuck with
exactly.
me. Yeah.
It's half of what we've been taught is correct. The problem is we don't know which half. We really don't know which half, and the data will keep choosing. So the whole thing about that, I have a pulmonary embolus, I can't take hormones, so I feel frustrated. Okay, the fact is you had a pulmonary embolus. We have a lot of thoughts. Different doctors are going to tell you about this. And it doesn't have to be pulmonary embolus, could be whatever scenario. And there's okay, so your thought could be, I'm going to speak to 3 different experts about the risks and benefits for my scenario. That's a more empowering thought. And then you'll come up with, okay, 3 different, opinions about what to do. And you could come up with a thought, and I am going to make an informed choice based on what I want to do with my HRT, based on my mom had breast cancer, I had endometrial cancer, I had like whatever the circumstances are, saying to yourself, I'm going to make an informed choice and I've decided not to take hormone therapy,
Yep.
right?
Yep.
That makes sense because
Yep.
you could go to a country where hormones are over the counter and buy whatever you want if you really wanted to.
You can get testosterone in the airport in Mexico, my friends.
Exactly.
Next to your cheeseburger and cerveza.
Yes. I'm in San Diego, so people got a lot of things here that they were not prescribed. So just saying, we're not as powerless.
Yeah,
Yes,
totally.
exactly.
Thank you so much for joining me. This hour flew by. Tell everybody about empowering women physicians. I know it's not for everybody. You have a niche coaching business because there's a million physicians.
A few 100,000 women.
Few 100,000 women physicians. Tell us real quick about that because not everybody knows the amazing help you offer.
Yeah. So I now full-time run a coaching company called Empowering Women Physicians, and we help. People are always like, what do you coach on? I'm like, any issue a woman physician has, that's how coaching works. So any issue that women physicians have, they come to us. And physicians, like I have a podcast with the same name, Empowering Women Physicians, and people who aren't physicians listen to it and they're like, so physicians are just people too? And like they have issues too?
Yeah.
They have insecurities too, and they have issues with their spouse too, and they are worried about money too, and they want to quit their jobs too, and right? Everything that a human being listening to this has, women physicians have those same issues too. We are people just like everyone else and have the same psychology as everyone else. So that's what we do. We do it in one-on-one and group coaching, and it's been an incredibly meaningful thing to be able to do in the world. And you are one example of the types of differences that it can make when you help someone shift one thought just a little bit. And then the compound effect of them doing that over time changes the trajectory of their lives. So it's incredible to be able to spend time with people and do that with them.
I mean, I say this kind of in a flip way, but I think it's a thought I'm choosing to believe. Everything in my life right now is because of coaching.
I love this. I love that thought. And you know what? I have the same thought because my life has changed so much because of coaching. So much. In the most beautiful way. So I couldn't agree with you more.
Yeah.
I love it.
Powerful. It's like 8 fruits and vegetables, a liter of water, 8 hours of sleep, and some exercise, and coaching.
Exactly. Because reframing your thoughts, it changes the power to know you can.
I love the humility of it. I think there's something very, whether this is spiritual or not, I'm going to choose to say it's spiritual, to realize the humility in like, you could be wrong. Right? Like, maybe not. I just think there's something so beautiful. Like, I think there's a little bit of ego work there, right? Of like, if you think you're so right all the time and you're never wrong and you should never question anything that you think, like, try the opposite of that. See how it goes.
Yes. Like Byron Katie, the work. Anybody here who wants to Google and look up Byron Katie, the work, when you pick one thought that's causing you a lot of pain and you just ask yourself,
and you flip it.
Is it true?
Is it true?
Is it true? Yeah. And you can always find that it's not true.
Yeah.
Yeah.
I know.
Yeah.
It becomes a playful trick at some point.
Yes.
Oh, my friend Sunny Smith, it's been a long time coming to have you on the podcast, like episode in the mid 300s at this point, and this is a perfect place for you to come in. So thank you so much.
Thank you so much for having me. It was so much fun.